Start.
Hello everyone, welcome to Skinfluence podcast. I'm your board certified dermatologist, Dr. Aparna Krishnappa. Today we are joined by my very own friend, Dr. Varnika, a board certified plastic surgeon. Hello, Dr. Varnika.
Hi, Dr. Aparna.
We meet again.
Yes, I'm so happy.
Yes. So, how have you been?
I've been good. How are you?
Good, good. So, good means I've been trying to work on something which is still not working on me, which is a weight loss program.
Okay. Yeah.
So, I've also been, trying to work hard in that, to shed some weight. But I get my own patients coming and asking me itself, what do we do, when I'm not shedding. So, any light you want to throw on that, any suggestions and...
Yeah, Aparna, I think there is something that we all have been here floating around, something that starts with O.
Yes, yes.
As you all know, it's Ozempic.
Right.
But yeah, we are not here to discuss about the drug. I think that has been done to death. Today we are here probably to discuss about the side effects of it.
Exactly. So here today we are discussing about the very own implications about Ozempic and what it actually does to the human body, especially the skin, and how do we manage it. So we are going to get all the answers from Dr. Varnika today. So yes, let's dig into it. So what exactly is this Ozempic, or if not to name the brand, what is this weight loss, which is the magic weapon which is going on?
So there are many names that we have come across, like Ozempic or Mounjaro or something else. They are basically semaglutides. So these are a group of drugs which inhibit your appetite. So you basically reduce your intake, and because of that the metabolism increases. It helps in better insulin resistance and everything. So because of that the patient starts losing weight at a very fast rate. So the patient can lose up to like 15 to 20 kilos in a matter of 2-3 months. So these are the things which happen at a very rapid scale, and the body undergoes very drastic transformation in these 3 to 4 months. So that is why anything that occurs at such a fast pace also comes with multiple complications. So one of that is what we call as Ozempic phase.
Okay. So I've got one question. So one of my patients had just walked into my OP, and then she's saying that she's gone into this treatment and she's lost 15 kgs, 15 kilograms, but she's quite happy with the weight loss, but she's definitely not she's not happy with the way she looks now.
Yeah.
So people are actually saying that she looks 10 years older,
Yes,
but not younger.
Yes.
So she was working on the weight loss, but with that aspect, the looks have changed. So what is your take on that?
So I would like to explain first of all what is an Ozempic phase, and I think a lot of us dermatologists, plastic surgeons have had this rush of patients who are like very unhappy with the way they look when they are on these weight loss drugs. This is because, as I said, when you lose fat so fast at such a high rate, the skin can't keep up. Especially for people who are in their 30s, the collagen production drops drastically. So what happens is you end up losing the superficial as well as the deep fat parts. And this is mostly in your mid-face area. So the patients will not have any like cheek fats, and even the malar and the buccal fat parts that are there. They shrink drastically to like 50% or less. So because of that, the very foundation of our face, the structure on which you get the jawline, the cheek line and all that, they disappear very fast. So the skin can't keep up, and you end up with hollows around the face, sagging skin, wrinkles, and a very dull looking skin per se. So that is why the patient looks like 5 to 10 years older than their actual age.
Correct. I think the pretty much what you explain, tells us what it does to our skin. But any preventive measures we can take before you go into this kind of weight loss?
Yeah, that's a very good thing. I always believe that prevention is the best cure.
Right.
So right from the start, when you are starting your Ozempic or any weight loss journey, I always suggest patients to also have like a routine of how they are going to tackle their face, how they are tackling their hair, skin, body in general. So try to incorporate retinoids, peptides, and most importantly, moisturizer and sunscreen. So these are the things which help in taking care of your skin texture and your the way your skin is going to be over a period of 3 4 months. When it comes to hair, make sure that you always keep an eye out if there is massive hair fall, how your hair texture, the quality, quantity, how it is changing. If that happens, please come and consult a dermatologist or plastic surgeon so that we can assess and give you some kind of either a serum or advise you for any invasive or a non-invasive treatment.
That's right. So, a few of my patients also say that they're losing hair.
Yeah.
One more thing I want to add is that as such, when patient they go for a intermittent fasting or any crash diet, they want to start with the just liquids, and they just want to eat one meal per day. As such, I've been tackling these kind of problems. They come back with the first thing I notice is the hair fall. Second thing, there is some kind of a dullness in the face.
Yeah.
Of course, because the hydration is lost.
Yes.
Okay, but like when they come to our OPD, like what other apart from our prescription-based medicines, would you like to add anything else with the nutrition, and would you like to counsel them, and what is your method of counseling them, how to take care?
So I always tell this thing to my patients that hair and skin, these are like high maintenance girlfriends. So they take offense at each of the small things that happen, and you need to take care of them every single day.
Oh yeah, right.
So
Please note that.
so the first thing I tell my patients when they come to the clinic is, first of all, understand what is the type of skin, type of hair that you have, and then use the products. Don't blindly follow some influencer or any like random product that has been given out on Instagram. First understand that, talk to your doctor and form a skincare and a hair care routine. That is the simplest thing that goes a long way. You don't need any extra chemicals or any kind of 100 products to maintain your hair or face. But a basic 3-4 step skincare routine and a hair care routine should be more than enough. Secondly, when you are losing weight at such a rapid rate, identify the signs. Know where your skin is sagging, where do you need, is there a volume loss, or as you rightly pointed out, is there just like a hydration deficit. So these are the things, if you identify early on, we can help you much better. If you come to us after that skin loss and fat loss happens and the skin becomes very saggy, then the amount of treatments and help that we can do is much lesser than the initial phase that we can be able to do. But I think a lot of patients also these days ask about all these non-surgical and non-invasive
Exactly, that was my next question to you.
So I think you are also doing quite a few of them, right now?
I am. So basically, the first thing, like I said, I tackle with the first question I get from most of my patients is like hair loss. And then I tell them, the diet, hair is the first thing which needs more nutrition.
Yeah.
So when we don't have enough nutrition going on in the body, of course your hair is affected. Okay. So I try to put them on a good nutritional support, number one. Be it oral or even intravenous nutritional support, and most of them do have B12 deficiency and AD, so I try to correct them with the iron if that deficit is also there. And coming to that hair, like I definitely suggest, if the patient is suitable for PRF or GFCs, definitely I try to enroll them, and with the daily maintenance medications. Along with that, I again say that nutritional support, what they eat, they should watch what the quality of food should be good, not the quantity. Of course, the quantity will reduce when as such the appetite is crashed in this, but at least what you're taking, take a good food so that there's a balanced portion in everything. Coming to the skin, of course, I see that a lot of patients come. First thing they say, my eyes are looking dull.
Yeah.
So that gives away. Why are you looking depressed? That's how slowly when the patient is going to lose for about 4 to 5 kilos, and that's when the features of weight loss in the face starts coming in. And they say, I'm looking dull, my eyes are like looking droopy, and there are dark circles.
Yes.
And the skin is looking dull.
Yes.
And definitely you can come to know it's not a hydrated face at all. So I try to enroll them into hydrofacials, and also if there is anti-aging I'd like to do. The most importantly, I would love to do Morpheus 8 so that there is a skin tightening parallel can happen.
Yeah.
And even 30 plus patients also, even for the double chin and for the neck tightening also is suggested. And Botox and skin boosters can help in a major role. Yeah, but other than that, like, the fillers,
Yeah.
that could also happen. But would you suggest fillers while the patient is on,
weight loss
until the
therapy,
patient is done with the weight loss program, or would you suggest doing it along the process?
No. So I generally tell patients that you have to come to me when you are at a plateau. So it's not like you are like in that crazy up and down of losing, gaining weight. Because then whatever we inject into the patient, because of the body metabolism, everything just gets broken down very fast. So whatever we do, the results do not last long. And another thing that I wanted to like add in between is a lot of people when they experience these hair loss or face sagging, the first thing that they go to is they try to just go to over the counter and get minoxidil.
Oh.
That is one thing I want to say, that please guys, that is not like a one-step solution for everyone.
Exactly.
Because the way the mechanism of hair fall in this kind of a scenario is much different from that of like male pattern baldness or something else. So this is more like a stress-related hair fall that needs to be tackled in a much different way. The same thing when it comes to face, there are 3-4 like characteristic areas of an Ozempic face. Number one being, like as you mentioned, hollowness around the eyes. The second thing is very, very saggy mid face. Third thing
volume
is,
loss.
The third thing is people tend to have something that we call as a granny jaw. So that is like folds around your neck and very like saggy skin that you classically see in patients who are above 50. But nowadays with these weight loss patients, we see them even in their like 30s and early 40s. So for those patients, it's not just about filling the volume, but it is also about addressing the saggy skin and also trying to think of some way to lift it. So as you said, I think fillers is a good option in the early stages where there is just volume loss but the skin is still flexible and it is good. So around the eyes and over the cheeks and somewhere around the jawline, if we want, we can help with fillers. But over a period of time, I would suggest that if the patient is in the moderate to severe category, it is better to go for something like a fat grafting along with exosomes or fat grafting along with PRF, because that helps build a foundation on which the skin can be tethered. Then the second thing, like as you said, Morpheus 8, that is also like a very good option. But if the patient has anything deeper or like if you feel that there is also massive collagen loss, another thing that I suggest to patient is either HIFU or ART therapy. That is also meant to like develop collagen over a period of 3 to 4 months. So that is also very useful. These are the basic things I think that help non-surgically. But once the patient has moved on to that severe phase, I think then we'll have to counsel them that surgery is the only option. And in surgery wise also, now we are seeing that mini lifts are becoming more of a trend.
So can you elaborate what is?
So a lot of patients these days, they don't want like that plasticky appearance or like their complete face done. So in that case, we do something called as personalized procedure, where we attend only the area that requires attention instead of transforming their whole face. So in this case, people who have that classic Ozempic face, as I said, have that mid-face sagging. So for them, addressing only that point, only the ligaments around your mid-face, tightening them, improving your cheek line and the jawline and filling it up is where it does most of the work. So for these people, it's not like a total lift, it's only the lift in the mid-face, and that goes a long way. So along with that, we try to give fat grafting to fill the hollowness, and if required, a little bit of jawline change also we give them. So these are the surgical treatments that are generally done. Some people, once they are older and there is like a lot of neck sagging or neck like deepening, in those cases I tend to do like deep plane neck lift. So where we not only address the jawline, but we also address the double chin and all these platysmal bands that the patient has.
Okay. So that was very informative. Now, can I ask you a question? Like, I think we pretty much talked about the face, Ozempic face and neck. Can we talk about the body? Like, what actually happens? What are the bodily changes that happens? And how do you prevent, and also how do you correct after the weight loss?
So that's also a very good question, because face is the only thing that is visible to everyone. That's why articles are written about that. But hidden under all those layers of clothing, the body also undergoes massive changes. And two things that I have seen mainly in my patients is, one is breast sagging and the second is massive folds over their tummy region. So these are the two areas where the patients present to us most. And the third one is in back wings around the arms.
Okay.
Because what happens is when there is so much volume loss again and you're not building any kind of muscle, so there is like a dead space that happens, and anyways this tissue flexibility, the skin elasticity goes for a toss. So the patient ends up with, as I said, like a 60-year-old grandma look where there is like, a deflated skin hanging down there. So in those patients, unfortunately, we don't have any other option but rather to go for surgery. So for breast, we have a combination of a breast lift with augmentation with either like their own tissue or a filler or with like a breast implant. And for the abdominal region, we do something called as a tummy tuck or a 360-degree tuck, where we completely transform the midriff 360 degrees front and back and helps in pulling up the buttock also. And arms, as we know, we have to do liposuction and a little bit of arm lift.
Wow, I think that's a lot of procedures.
Yes.
What we have to.
Yes. So that is why I say that when you are starting your journey, have a plan.
Exactly.
What I would suggest is invest in skincare. Try to get as many massages done so that your skin keeps up with the rate of your fat loss. And then check in with yourself time to time. A lot of people, once they start these drugs, the only thing that matters to them is the number on the scale. How many kilos have they lost, and how many inches they have lost. But apart from that, you should look for signs like, is your skin getting dull, dehydrated? Is there sagging? Is there any part of the skin which is becoming unusual? These are the early signs that you should pick up. Only then, you will be able to keep up with the body. So good diet, I think massages, and also probably good exercise, weightlifting exercises, because the more muscle mass you build, the more toned your body will look. I think these are the 3-4 things that I would suggest patients.
So a new thing is that from what I've learned from you is, when you're on a weight loss program, don't just look down at the towards the weight loss machine.
Yes.
Please look front into yourself, into a mirror, and see what changes you're going through, and address those concerns to your plastic surgeon and also a dermatologist, and definitely they'll be able to help you. Another question I've got is, will I lose my younger look, like how I used to look? So will I be able to look the same, or like despite of all these corrections and taking care, will I look same after this?
See, once you are on a fat loss diet, the way your skin responds is different from person to person. So if, for example, 3 of us are taking the same drug, the way all 3 of us come out of it will be drastically different. It depends on your genetics, it depends on your skin structure, the facial bone structure and everything. So nobody will look exactly like how you looked before the journey, but probably what I can say is, depending on your genetics and the rate of weight loss, you might look a little bit closer to it, or a little bit younger. But one thing is there, that if you completely stop the weight loss journey, the reversal is never 100%. You can't go back to looking exactly the same way that you looked probably a year back or whatever it is. There will always be some sign of changes that happens because of this weight loss.
Okay. So great. I think we've discussed about invasive and non-invasive, surgical and non-surgical approach to this correction post weight loss, and also you've given a beautiful preventive tips and how to maintain your skin. I've got some questions on my DMs, and it's I think I should ask you them. With your permission, can I?
Definitely. Okay.
Okay. Let's do a quick fire myth round then. If I stop Ozempic, will my face bounce back?
Unfortunately, the face does not accumulate that way. It will take some time, but yeah, you will never get back 100% to what you looked like before.
Great. Okay. The next question is, can skincare alone reverse Ozempic face?
No. Because as we discussed, skincare is just one part of it. There is actually deeper fat loss and tissue loss. So yes, skincare does help because it helps in maintaining the elasticity and the texture of the skin. But no, it is not the complete solution to the problem.
Great. Are facelifts overkill?
No. Personally, I feel if done by the correct surgeon, they can actually be a drastic change and bring such beauty to your face.
Great. So great, I think we've discussed everything about, and all my questions are answered. Thank you so much. One more question I've got.
Yes. Fire away.
Okay, so should I just start Ozempic or any other weight loss program? And I'm sure you're there to correct all my deficits which are going to happen. So what do you say?
So I think you're smart enough that way. See, Ozempic I feel is not a bad drug. It's only the way that we use it that has led to all these complications. So I would suggest you first meet an endocrinologist, get your blood workup done, and depending on the results, then probably have a discussion about the dosage and how long would you need it, and then simultaneously formulate a plan for yourself that what are the care that you're going to take for your skin, for your hair, for your face. And yeah, I think that would go a long way that way. And this applies to anyone who wants to start on a weight loss journey. Don't be scared of the Ozempic or any other weight loss drugs, but you should always consult a proper doctor and take it as a proper medication.
Correct. So whether you're on Ozempic or any other weight loss program, there's no one size fits all. So please talk to your dermatologist or your plastic surgeons to get your good expert skincare routine, hair care routine, and also treat your skin with soul. Thank you so much, Dr. Varnika, for joining in today and enlightening us on weight loss program like Ozempic and their implications.
Thank you, Aparna. It was, I think, very enlightening. We covered a lot of topics.
Yes. Meet you in the next podcast.
Yes.
Thank you.
Thank you.